I'm Jeremy Cosson. On today's episode, we have Dr. Michael Hart, who's going to discuss how cannabis can be used to treat PTSD and chronic pain. Welcome to The Straight Dope from Canna Authority. I'm your host, Jeremy Cosson. So in today's episode, it's part 2 with Dr. Michael Hart. Michael Hart, as you might remember, is the head physician at Marijuana for Trauma in Ontario, Canada, where he works with veterans and other patients suffering from conditions such as PTSD and chronic pain. In today's episode, we're going to talk about how to reduce opioid use, how states with medical marijuana laws have significantly lower levels of opioid overdoses, co-morbidity of PTSD with opioid use, how one can improve their life by treating with cannabis over other drugs. Dr. Hart has worked with patients who've lost significant amounts of weight, have been able to exercise, elevated their moods. Also, some of the dangers around using opioids, for example, that zombie effect that many people complain about. And we'll also talk about some of the different myths around cannabis use and also what are some of the risks involved, because of course everything does have risks. So without further ado, I'd like to welcome Dr. Michael Hart. Dr. Michael Hart, can you share with us some of the success that you've had in terms of treating veterans and other patients who may have been suffering from opioid dependency and how you've treated them with cannabis?
I have been very successful in reducing opioid use with cannabis use. There's multiple studies out there that have shown that cannabis use can decrease opioid use and improve overall function. There was a study done in the United States, over 10-year study that showed that the states that have medical marijuana laws, the states that just have laws, that's all I'm talking about, have a 25% lower mortality rate than the states from opioids and the states that don't have laws. So we know for sure that it's absolutely effective for reducing opioid use, and I've seen it in my practice. And I know you just mentioned opioids, so I just really want to mention that before we moved on.
I think there's 18,000 opioid overdoses per year in the U.S. and high in Canada as well. And it seems like, given the research, that cannabis could play an important role in terms of helping address an epidemic level.
Absolutely. And as I said, we've been really successful so far at treating a lot of different patients. And I think that one of the keys in the future is they're going to need to change the guidelines, because like right now, Jeremy, it's still written in the guidelines that I should be prescribing opioids over cannabis, right? And to a lot of people, that just sounds completely insane. And the reason why it sounds insane is because cannabis has been deemed to be so much more effective and safe through a lot of recent studies. And you mentioned about the number of how many patients are dying in the United States. And we certainly know that it's in the tens of thousands, and we know that no one's ever died from cannabis. And in addition to that, Jeremy, we're not talking about all the morbidity that it's causing as well. I touched on earlier a little about opioid-induced androgen deficiency syndrome. So what about the patients who aren't dying and have their lives affected in a negative way? They can no longer have sex. They don't have the well-being that they used to have because of lower hormone levels. So I think that it's important not just to talk about the mortality, but also the morbidity that it places on the system as well.
How common is that comorbidity between, let's say, PTSD and then dealing with chronic pain as well, and having to take all of these different prescription medications? Is that pretty common that you see?
It's very, very common. And what happens too in that type of situation is a lot of these guys who start to take these medicines, their symptoms, their injury isn't treated. So I touched on earlier about them not leaving their house. So they're not able to leave their house, and then they're taking these different medicines. And unfortunately, a lot of these medicines are not working. And as the literature has shown that as well. And then because their medicine's not working, this habit of staying in their house just gets reinforced over and over and over again. So it's actually, I'm not saying that that the medicine is making it worse. What I'm saying is that the reinforcement is making it worse for sure. And the fact that the medicine is not working is not helping them.
And then also with this narcotic medication, I can see how it could be beneficial very short term. Somebody has surgery and maybe for a month or a couple of weeks, but it seems like inevitably if somebody's on that long term, they're going to develop a physical dependence.
Absolutely. Yeah. And whenever you take anything long term, that's something that you really, really want to evaluate. And you want to know whether or not someone's overall function is going to improve when you use that medicine. And again, there's not a lot of data out there, and it's just from my own perspective that I'm saying this, but I've seen a lot of patients that use heavy narcotics and their overall function is not improving. Yes, sometimes it is effective for treating their pain, and it can add to their overall quality of life. But for the most part, patients who use cannabis with the right strain under the care of a physician will have better improved function, meaning that they can go out of their house a lot more. They can do their groceries, they can do their dishes, they can do their household chores, and they're able to leave their house more, they're able to work more. One of the questions I have on a follow-up form with every single person is, what are you able to do with cannabis that you couldn't do otherwise? And people will list multiple things. And sometimes it includes exercise. A lot of times it includes exercise and weight loss. And you don't get that with the opioid use. It seems like the goal of the opioid use is to reduce their pain, but even though a lot of physicians are very genuine and they do want to improve the function of those patients, in my experience, their functions do not improve as well as when they use a proper form of cannabis. And my goal is not just to take away my patient's pain. My goal is to help them live the best life that they can possibly live. And in my experience, a lot of patients can really improve their overall life. Several different things will change in their lifestyle after they start using cannabis. I can't say that I see that with opioid use. And that's part of the reason why I'm so confident when I do prescribe cannabis, is because I do have patients that once they start using it, their relationships get better because they're treating other people better. Relationships with their and it's not just with their wives and their kids. It's also with their friends. They say that their friends tell them that they're very, very different, and their whole life improves. And in addition to that, a lot of these guys will start eating better, and they'll start start exercising. I have so many patients that have lost 20 pounds, 30 pounds since they started using cannabis. So a lot of different uses for it.
So I guess the differences between an opioid and cannabis is an opioid, it numbs the pain, but whereas cannabis can improve a person's overall well-being and quality of life. Is that right?
Yeah, and there's a couple different things. So THC is good for pain control, absolutely. But in addition to that, what a lot of people will say is, because THC can be a mood elevator, they say that they can still feel their pain, but they just don't care anymore. They're like, it only takes away maybe 25%, sometimes 50% of their pain, but they just don't care about it. They have a better mood and a better perspective on their pain, and that's part of the treatment. It's improving their overall function. Whereas a lot of patients who use opioids, not necessarily in the first couple of weeks, because sometimes it can be effective in the first couple of weeks, but generally speaking, the opioid may help improve their pain, but then it can cause some other cognitive deficits, and they won't be improving their overall function, their overall quality of life. And that's been, again, from my experience, what I've seen.
I've talked to a lot of people who they say that the opioid made them feel like gave them a zombie effect or whatever. And it was totally counterproductive. And
there's a lot of people, I'm sure Jeremy, especially where you live, a lot of really, really intelligent people who use cannabis and are big advocates about using cannabis. We don't have people coming out saying that, I started using Percocets and my whole life changed. We don't have people coming out and saying that. And I think that it's really important that we start to look at some of these cases.
One of the myths that I had said, I remember, back when I was a kid, cannabis kills brain cells and stuff like that. Well, we know that overusage can have an impact on short-term memory, but that whole myth about it actually killing brain cells, it's the opposite, is it not?
Yeah. There's no real truth to that. I mean, you hit the nail on the head. If you are a chronic user, it can cause some short-term memory impairment. But if you discontinue using it, even for about a month, then everything basically just comes back. And like one of the things too, Jeremy, is cannabis decreases your memories of your nightmares. That's part of the reason why it works. Like there's a risk and benefit ratio to every single drug. Like patients who have PTSD, they don't want to remember their memories. That is the treatment, right? So if they don't remember their memories or they don't remember their nightmares while they're going to sleep, then fantastic. That's actually our goal. That's what we're looking for. So you have to take into consideration risk and benefit with everything and realize how the medication works. And part of the medication, part of the reason why the medication works is because it does disrupt your memory.
And how you recommend cannabis, as we talked about before earlier, is that could be a first line of defense, but other times people may have been using opioids before. So maybe it's as a stepping off or a potentiator so they can use less, or what are some of the different ways that it can be used, and how do you see it being most efficacious?
So I think two different ways. So we should talk about patients that are not on opioids and then on patients who are on opioids. So if you are a patient and you're on opioids and you're functioning fantastic and there's nothing going wrong and you're happy and your physician's happy, then I don't see anything wrong with keeping up with the opioids in a situation like that. I don't really see situations like that in my practice. And plus, I don't prescribe opioids. I prescribe cannabis, so I don't get those patients. So I get a lot of patients who are using opioids that want to come off of opioids. And I've been very successful at doing that, as have a lot of other physicians. So I usually try to get them to reduce at least by 25% over 3 to 4 months is what I start off with. But sometimes patients will come back even after the first visit, after 3 months, and they'll have eliminated everything completely. So I think that's really important. And then the other thing too, what about patients who are not on opioids but they do have some chronic pain? And I have patients like that too. So they come to me and they say, I've heard a lot of bad things about opioids. I want to use cannabis instead. And then I treat them with cannabis instead of opioids because I feel comfortable prescribing cannabis over opioids. And I have a lot of experience doing that, and I've seen the results. But unfortunately, like we touched on earlier, it's not in the curriculum right now. And that's why a lot of physicians are still prescribing opioids over cannabis use.
Any success stories that you've had that were particularly impressive?
Sure. Yeah, I have a couple, and I can give you an example of a civilian and an example of a veteran as well. So I don't have, because I'm a family physician, I largely deal with things that are within the scope of a family physician, so more or less health disorders. But I do have a lot of experience now dealing with seizure disorders. And I had a 23-year-old girl who was not able to drive. She was having seizures every day, up to 10 or 20 a week, and really affecting her overall quality of life. And she was on some anti-seizure pharmacotherapy, and we tried her on some cannabis. We tried CBD only. She uses CBD only, and now she's completely seizure-free, has been seizure-free for basically about 2 years. And we got a driver's license back about a month ago, and now she's driving again. There are those cases are, I don't want to say they're few and far between, but there is evidence that CBD is effective for irretractable epilepsy. And I've seen it in my own practice, and I've seen a patient eliminate their epilepsy and get their driver's license back. So it can, in fact, work. And then in my veteran practice, I can't really isolate one case. So what I'll try to tell you is I have hundreds of cases, literally, of guys that have, and girls, with 5+ medications, mostly sleep medications, pain medications, and anti-anxiety, depression medications that have come in to see me, and they haven't been able to leave their house, leaving their house less than 10 days a month, sleeping 2 to 4 hours a night with a bunch of nightmares every night, kicking their spouse in their sleep, wrecking the life, ruining relationships. And then literally 3 to 4 months later, they will tell me that they're able to leave their house almost every day. I don't want to exaggerate and say this is for every single person, but a lot of people say that an improvement in leaving their house. So maybe they don't leave their house 30 days a month, but they leave their house, 20 or 25 days a month instead of 5 or 10. And then they're getting 6 hours of sleep at night, and maybe they're getting a nightmare 1 or 2 nights a week. Instead of sleeping, 2 to 4 hours a night and getting a nightmare every night. But there are patients who do recover completely, but, not after 3 months, generally speaking. It's after a couple years. And Jeremy, it's very important to note too, that it's not just these guys are doing other things that are helping out with their PTSD as well.
So what are some of the other things that are done in conjunction? Lifestyle, exercise, and things like that as well?
Yes. And actually, I'm kind of glad you brought up exercise, because I've been talking about anandamide, and there's that's actually is what's released when you have your runner's high. So when you have your runner's high, that is the anandamide is released and attaches to your CB1 receptors, and that's what gives you that high effect. I'm glad you brought up the exercise. So exercise for sure is one. We also are really big into mindfulness and meditation, and then also eating well. And all those things are really going to help with your PTSD symptoms. So you gotta exercise, you gotta eat right, and in addition to that, we're really big on peer support. So we do peer support a couple nights a week, and we really encourage the veterans to help each other out, because we feel that in addition to the medicine, we really need a lot of communication with others who have also suffered the same type of loss and are going through the exact same type of thing, because that's what's going to help the patients heal. They need to hear some type of stories from other people, and to know that they're not alone in this world. And we're really big on group therapy.
In the U.S., 24 states and the District of Columbia where medical cannabis is legal. At least in California, they're pretty generalist in terms of these different dispensaries and stuff like that, or clinics. Do you see sort of an emergence of more sort of specialists where, like, okay, we deal with chronic pain, or we really specialize in PTSD or things like that, where they can go and they can have also that peer support as well? Because I think, it seems like maybe one of the shortfalls, I think, within at least my observance in California is the patient's a little bit left on their own in terms of figuring things out, because it's pretty loose in California as far as getting your recommendation, and you can go and, wherever. There's hundreds and hundreds of places, but I don't think most of them really provide that adjunct of support that would be helpful.
Yeah, and I think that's important, that the cannabis is just part of the therapy, and it's certainly not the entire therapy. And that's what we try to promote at MFT, and our CEO, Fabian Henry, says that as well. There is no cure for PTSD, and we don't say that marijuana is a cure for PTSD, because it's absolutely not. And he was asked a question one time, is it a Band-Aid? And he said, yes, it is. It's a Band-Aid solution. It's the best Band-Aid that we have. If Fabian, and I know you said not to mention people's names, but he would not have any issues when you mentioned his name. So for someone like that, cannabis is going to be extremely important for part of their treatment, and he's already had it as part of his treatment for a couple of years now, and has been successful with it. So the focus is really just on getting the word out about how cannabis can help treat PTSD. And coming back to your original question, I think that it's difficult to become a sort of a specialist or to get the right strain for the right ailment, because we are still teasing out all of that information right now. But I don't know if in the future, if you're going to see cannabis clinics where the doctor is only comfortable prescribing certain strains, and another cannabis clinic where, a doctor is only comfortable prescribing certain strains. But that certainly does make sense in its own right, because we have that right now with pharmacotherapy. We have different specialists that, there's certain drugs that I don't feel comfortable writing because I'm not a specialist. I'm a family doctor. And there may be in the future, certain strains that are, maybe there'll be strains that are extremely high in THC that only a psychiatrist who has seen lots of PTSD should be able to write. Maybe something like that will happen. But in the future, I think that we're going to need a few more years of teasing out the science and doctors kind of figuring out what cannabis helps treat different ailments.
Yeah, you've shared some great insights. I guess maybe like in closing, a couple of things, like what's sort of the status of research in Canada right now, and maybe how does it differ from the US? And then also if somebody's listening to this and they want to learn more about the endocannabinoid system, and then also how PTSD and cannabis, or how cannabis can be used to treat PTSD or chronic pain, are there particular resources or any books that you recommend or suggest?
I really just go on PubMed and see and look at the studies myself. And then I'm fortunate from the fact that I see a lot of PTSD patients, and I get to learn from my patients every day. So as far as resources for patients, Marijuana for Trauma is the organization that I work for, and they do have a website and a Facebook page where they share a lot of different stories, and then also some educational information on PTSD. I do that myself as well. A really good source for any type of psychedelic medicine research is MAPS. And you were talking earlier about the DEA, and I had actually found out that about the DEA funding the study for PTSD in veterans through MAPS. So that would probably be one of the better resources. There's also a website called resetme.com where people kind of share some stories about different medicines that people may find helpful as well. And there's some information there on how cannabis can help PTSD. But a lot of those are largely just like anecdotal stories and personal stories from people. If you really want to find out like the scientific literature, just do a search on PubMed for PTSD and dig through it and see what you can find.
Some of the studies are written differently than other ones, but some of them get really esoteric, I think, too.
Yeah. I mean, it's really easy to, like crap on the research for lack of a better word, because, I have colleagues that think that some of the things that people write are not very scientific. And I understand that. But the thing is we're so early in the infancy that we need to take every bit of information that we have and try to utilize it. And some of the information may not be useful, but there'll be a lot of information that will absolutely will be useful. And the more information that we can accumulate, then the more legitimate we can make marijuana as a medicine. So it's really easy to kind of, crap on anyone that's doing any type of marijuana research right now, because it is in fact in its infancy. But you've got to start from somewhere. So I actually applaud anyone who's putting information on there about cannabis out there. The only thing I would say is that when the experience that I have is in the cannabis industry is a lot of people are either very pro or very against it. And it's okay to be very pro or to be very against it. You've got to be very, very objective. So I try to be as objective as possible. And I think that's where we've gotten into trouble. And that's why cannabis is not legal, is because the people who have talked about the benefits have not talked about some of the consequences. And because of that, then, it really doesn't make you look legitimate, because you're really just promoting everything that's good about it and nothing that's wrong about it. And I know I haven't touched too much on what's wrong about it here today. And if you have a minute, we can go over that. But if not, we can certainly save that for another time as well.
No, that's a good point. It's problematic when you exaggerate the benefits and not share everything, because it undermines your credibility, as you said. And also, when I've poured through the research, there are things where people are grossly exaggerating studies. And I've spoken to the researchers themselves and asked them specifically about, let's say cancer is a big one. And Dr. Donald Abrams is quoted regularly, but he's misrepresented in a lot of different articles that I've seen, where they say people are saying declaratively that cannabis cures cancer. Well, I interviewed Dr. Abrams. That's not what he said at all. And they'll exaggerate the findings of certain studies. And if we don't present both sides, that there are risks and there are rewards, and this is what realistically we know it can do and what we don't know it can do, pendulums seem to shift. And so now everything's very pro in terms of opening up. But if we don't, as you said, be objective with the information, it could be very counterproductive.
Yeah, and I do just want to take this time, Jeremy, just to mention that I don't prescribe THC to patients below the age of 25. There is some, and I know some people, think that I'm being a little bit too conservative with that, but there is some harm that THC can harm the developing brain. And so that is the reason for that. However, I'm not against prescribing CBD to patients below the age of 25, because that's a totally different story. And I think it is important to note some of the detrimental effects that can have. And anyone who, another thing that I just wanted to mention too, is anyone who hasn't used cannabis before, I really do not recommend them using a sativa starting off, as I found that those are the strains that cause more anxiety than the indica blends.
Describing some of the risks as well, the number that you had quoted, and that's the number that I've heard as well, most commonly, is about 9% of people who try cannabis develop, I think, cannabis use disorder. And so maybe you can share the benefits, but some of the risks as well, and that people should be cautious of.
Sure. And cannabis use disorder is something that, we should talk about, because, and it doesn't just apply necessarily to cannabis, but anytime you take a substance, you really need to evaluate, as I touched on earlier, not just on it's alleviating your symptoms. So it's great if you have back pain and it's alleviating your pain, that's great. And we need to evaluate that. But as a physician and as a patient, you should evaluate a little bit more. Okay, my back pain is now gone. What's that doing for me? Am I able to exercise more? Is it making my mood better so I'm treating others better? That's the type of thing that we really, really need to be evaluating when we're evaluating our patients. And that's what we try to do at Marijuana for Trauma.
Thanks so much. I really appreciate it, Dr. Hart.
Well, I really appreciate being on the podcast, Jeremy, and I had a great chat today. There's so much to talk about with cannabis, and I would love to come back on again anytime.
Thank you so much for joining us for today's episode of Canna Authorities, The Straight Dope. I want to thank Michael Hart. So again, thank you so much for joining The Straight Dope from cannaauthority.us. Be sure to visit our website, www.cannaauthority.us, and sign up for our newsletter for upcoming events and upcoming podcasts.